completely, or sometimes there was a mutation in the gene that led to the gene basically not being produced. So the protein wasn't actually produced, and so there was an extra base pair, a missing base pair, or a change that said don't express this gene. So our patient actually had what's called a missense variant, meaning that the protein was actually being produced, but it had a change in it. And because this has not been a commonly described in classic Mowat-Wilson syndrome, even though we have hypothesized that there are probably a number of individuals that have this type of genetic change, but perhaps they don't have absolutely classic features of Mowat-Wilson syndrome, the lab that ran the test was not willing to come out and say for sure this is the answer. Even though for the scientists out here it was de novo and it was in a highly conserved amino acid and it was predicted to be deleterious. So it kind of had all of the features that you would go on, but they said that, you know what, this hasn't really been described frequently, and so we're not willing to come out and say this is the answer. And so the family contacted me and said, can you help us? Can you tell us, is this the answer we've been searching for our daughter? So I said, well, first you need to send me some pictures. Because again, that really has been part of the whole diagnostic story for many of these patients. And so this is their daughter. And you can see that she definitely has some facial features that are suggestive of Mowat-Wilson syndrome. Her ears are not absolutely typical, and I know that this has kind of gone back and forth, and there have been other individuals described with this kind of milder mutation that do have typical ears and some that don't. But I would say her ears are not absolutely typical, but the rest of her facial features and kind of her whole history really made us say, I think this is the answer for you. I actually talked with a group of colleagues of mine at CHOP who had two other patients similar to this, and we kind of got together and talked about it and said, yeah, you know, I think this is the answer for you. So like I said, there are at least two other children in the United States who've been identified with missense mutations. There have been other cases from other countries that have also been described. For the three patients in this country that I am aware of, or my patient in another country and the other two in this country, all of them really had mild cognitive impairment, which kind of goes against what we've been told about Mowat-Wilson syndrome before. None of them had Hirschsprung disease, but two had constipation. One did have hypospadias and agenesis of the corpus callosum, and only one had microcephaly. And again, I think this is leading us to say this is a condition in which there is probably a much wider spectrum than we actually originally appreciated. And like I said, we kind of hypothesized that that was probably going to be the case, but we're just now starting to see it because we didn't know how to identify kids that have milder forms of Mowat-Wilson syndrome. But again, and this is a paper that is in press right now that talks about the patient I just presented, along with several other individuals with Mowat-Wilson syndrome who have craniosynostosis, which is a premature fusion of one of the sutures in the skull. And I've had one child with that, and again, question is it part of the condition? Is it not? Because again, craniosynostosis, even though it's not amazingly common, it certainly could be possible that you could have a child that has co-occurrence of two different things. When you see one patient that has one unusual feature, you never know it's related, but when you start to see more than one, you question, could this really be expanding what we know about this condition? Is this something that we might see more of? There have been several individuals described with choanal atresia, which is where the bony part that connects your nose to your nasopharynx, it's there in utero, and it's supposed to regress and go away, so you have a whole connection between your nose and your nasopharynx. That doesn't go away. That's what choanal atresia is, so that can lead to respiratory issues right after birth. Structural eye defects, we knew that there were individuals that had that before. We're seeing that a little bit more. We've had one patient with a cleft palate. And like I said, we're starting to see kids that really have milder intellectual disability as well. Like I said, sometimes we wonder, are they truly related? And I think that as kind of echoing what previous speakers have said, I think that the power of having a group like this is going to allow us to say, can we collect a lot of very rich information about this condition that can help us know what is the spectrum? And once we identify that, then we can start working on how do we address it. And I think we need to do better natural history studies, particularly looking well into adulthood, because we don't have a lot of information about adults with this condition, and that's probably one of the biggest questions that I get from families when I see them in clinic is, what is my child going to be like as an adult? And we can't absolutely answer that question. Obviously, you can't answer that question for anyone in the general population, but we'd like to have a much better idea of, are there health issues that are going to crop up in adulthood that we don't know about that we need to be looking for? What types of interventions are really going to help in terms of functionality, and what would typical functioning be for an individual with this condition, so people can kind of plan ahead of, this is, at least in general, what we are going to be looking at longer term. And I think we need to look at individuals that have more typical mutations, and we need to look at individuals that have milder mutations, so that we really understand what the full spectrum is. And so what I'd like to leave you with is that I think that now that we're using a variety of different mechanisms to investigate genetic conditions, we're going to be finding individuals that have this condition who have atypical or non-classic features. And then, like I said, I think the power of this group is to be able to teach us what this condition is, so then we can pass that on to the future.